Hello, Steve White, Steve Arts 89. This is just a little bit of something from my COVID therapy, YouTube therapy sort of series of life drama. Look, over Christmas, no one from my family contacted me. It's kind of depressing. When my mother died, and I stopped, I think there was sort of like I think a silver lining for everyone else in the family in that they wouldn't have to see me again, because I usually travelled to see my mum and then I'd see them when they were seeing her, and I don't think anyone really wanted to see me. I don't really think my family likes me. I don't think they ever really have. I never fit in. And, they're still in that sort of bubble where gays are embarrassing and not really, they're only really accepted on sort of terms if they're straight acting, and the good gays who, don't, rock the boat or anything, and I'm not one of those people at all. I rock the boat all the time. You're going to have to rock the boat, otherwise, things don't change. But, it's been very depressing. And I was just thinking back to a few things, and I'm just realising just how messed up some of the people in my family are. Like, one of the last times I travelled back, this is an example of one of my relatives. They had sort of taken over control of my mother's treatment. And while some people would appreciate that, like, oh, they're doing all the hard work, it was more about them and wanting to get the credit for, oh, I'm taking care of them, I'm a martyr, and not actually about actually taking care of them properly, as far as I can see. This person didn't have the capacity to do it. They were working full-time. They couldn't be there. They should have asked me to come in and stay with my mum and asked other people to be more involved who were also living there all year. I could have come over at any time, left what I was doing and stayed with her. But I didn't know where she was because they weren't letting me know. They weren't keeping in contact with me. Whether that was deliberate or just happened that way, I had no idea how sick she was. And they were just trying to manage it themselves. And they couldn't, and either they didn't let it go because they just wanted to do it themselves because they're that self-important, or they just didn't want to admit they couldn't handle it. I don't know, but either way, it should have been more delegated around more people. I know she did have some help. There were people coming in every day as well that were paid. So, but she really needed someone with her 24/7. But before this, when she was going through chemo, she didn't like chemo. She hated sitting there by herself. People would take her up, drop her off, and then go do their stuff, and then come back and pick her up, and she'd sit there the whole time by herself, and she didn't like it. So that's why when I travelled each time, she wanted me to come early so I could sit with her through the chemo and then get a lift back to my home with them, because otherwise I have to get a bus by myself, whatever. The airport is like in the city, and we live in a town like, I don't know how many kilometres away. It's like a 30-45 minute drive. And the first time I was supposed to do that, I'd been arranging to come over, and then this relative went a bit crazy, and they're like, you're flying up, because when you're in chemo you have to be very careful of your immune system. You can't be around people with colds or anything. And because I was travelling on a plane, this relative was convinced that I would be covered in bacteria or something, and I couldn't visit her. And I, of course, being the responsible adult, called the chemo place, the hospital where my mum was at, and asked her, could this possibly be a problem? And they said, no. If she couldn't go on a plane for those people, but you meeting up for her after being on a plane, no, it's no issue at all. So I spoke to my mother, and I arranged with her that I would come in at a certain time, and I'd come and meet her so I could sit in with the chemo with her. But I didn't actually mention it to this other relative because I just assumed it was getting late as well. I assumed my mother would tell them. Apparently she didn't. So when I got there, I walked in, and first off, I didn't recognise my mother. She was so sick and frail because I hadn't seen her for months. I didn't recognise her. I saw the relative, and I thought, oh, she must have gone in already. And I was just going over to ask her what room is she in. And I realised she was sitting next to her. That's how much I didn't recognise her. I tried to hide that. I don't think she caught on. We talked for a minute. And this relative was fuming that I had come. And she was starting to create damn it, I wasn't going to mention the sex. They were starting to, trying to be not vague here. I don't want to get in trouble because I've already been told off for talking about family stuff, because, you don't talk about the family. No one talks about the family. you're disloyal, you will be banished. I'm disloyal, I've been banished. Several members of my family don't really talk to me anymore. Just because I've dared to just mention a couple of things casually just from childhood and that. Not that there's any great secret or anything, or that's the other thing. There's nothing to even talk about. We had a fairly normal childhood. So I don't understand the drama. But so I knew she was going to, again, I knew this person was going to cause a drama. So I just said, I'm going to go shopping and I'll come back. I said that to Mum because I didn't want to upset her. I didn't want to argue with this person in a cancer ward full of cancer patients because this person would cause a scene there because that's what they like. So I just left. This person chased me out of the room, down the hall, and started arguing with me about why I was there and all that. And they actually said that I disobeyed them because they are such a control freak. They had to be in charge of all this. And that's why it wasn't so much about taking care of my mother. It was more about them just taking charge of it and being in control and it being about them, which is really disturbing to sort of kind of realise that's sort of how they think about the world. And even a situation as bad as that, they're that narcissistic that that's how they think. So I'm getting the elevator. I'm pushing the button like, dear God, let them not come all the way down the hall because they'd already come halfway down the hall yelling at me. I got in, I left, I thought, thank God I'm safe. I went out. I was standing on the corner of the LGH, Launceston General Hospital, across from that little shop. Everyone knows the little shop across from the LGH. There's two LGHs, there's like the old one and the new one, and they're like across the road from each other. And I was just standing there thinking, God, what do I do with the day now? I'm going to have to catch the bus at 5 o'clock. This was like 11 o'clock or 12 o'clock or something. And I was thinking, well, I could go see a movie. There's probably something on. I'm just standing there. And all of a sudden, this relative is there. And I'm wheeling my case. Like, I just came off the plane. I'm like carrying my case with me. And they were saying to me, they were trying to get me to go with them. I'm like, I'm not going with you. I don't have anything to do with you. Don't talk to me, leave me alone. And they were pulling on my case. They wouldn't let go of my case. I'm literally fighting in the street over my case with this crazy person because I just wanted to go and then catch the bus. And I'm begging with them. I'm exhausted. So I've just seen my mother look like a ghost compared to the last time I saw her. I'm not even over that yet. And now I'm fighting with them. And I just said, look, just let me, I just want to go in the city. I'll get the bus home myself. And I knew I could walk to my sister's place because she's about 15 minutes walk from the bus station. And then she could drive me to my mother's. I didn't have to deal with this other person at all. And eventually they let go of the case and just let me go. And I went to the city. I think I watched one of the Star Wars films. Whichever one was out before Rogue One, because I saw Rogue One a few days after Christmas, because I saw it the same day that Carrie Fisher died. I went into the film to see the scene at the end, basically, where they have young Carrie Fisher again with CGI. I walked out of the film and she was on a plane, had a heart attack, and she hadn't died yet, but she was not well. And by the time I got home from the bus, she'd passed away, I think. So I was just watching that on the news when I got home. It was really surreal to go from just watching her in her prime to now she's gone. So I think it might have been, I might have seen The Last Jedi then. I don't know, what year was that? I'm confused. Either way, I went to the movies. I went around, I looked at all these places, because I hadn't been in Launceston in years, because normally I would either get picked up from the airport or I would catch the bus, and I'd usually not have much room to look around. So I was just looking around, doing stuff. I went back, like I said, I got, my sister took me out there and then I saw my mum, and, you know, I would have liked to have sat with my mum through the chemotherapy that day. That's what she wanted and what we planned. But of course I couldn't, because this insane relative was outraged that I didn't do what they said, that I didn't obey them, that I arranged something with my mother outside of them. And just that level of controlling and narcissism, and I mean, there's other stories, but that was, I just wanted to deal with that one because that was just before, I believe this was just before Christmas, either Christmas or Easter. I think it was before Easter. I can't remember now, but I'm just going to talk about some of this stuff because it's my COVID therapy, and some people who like, you know, tea and gossip might enjoy someone else's family dramas, but it just also makes me feel better to talk about this stuff. I was thinking about it the other day and it bothered me, and I've got no one to talk about because I'm still sort of self-isolating because we don't know what's happening in Sydney. They've got 18 more cases in Sydney now, and whether it's going to end up filtering into Melbourne, whether we're going to have another third wave or not, or whether we'll be able to keep Sydney's problems out of Melbourne, I don't know. Went to the dentist yesterday. incredibly anxious because maybe someone's already infecting people and we won't know until it starts showing up in, the test in a couple of days. Who knows? I could be standing right next to someone from Sydney. Who knows? Kind of freaked me out, and I'm still having toothache because they replaced a filling that came out at the back and assumed that was causing all the pain, but there was pain further down on the same jaw. But they didn't X-ray. Nothing jumped out obvious, so I don't know what it is. But so I'm trying to distract myself from that as well because I can't get appointment until the 12th of January, and that's just to talk to someone about getting an actual appointment to actually deal with the actual problem. So I'm just trying to do something constructive to deal with my anxiety and that, and I do want to just share some of these stories because it is helping me talk about these problems and that over the last few years that have happened. But I'm going to go. Feel free to share, like, comment, subscribe, let me know what you think, maybe even ding the little bell. It does help.